In this video, here's what we'll cover: what trauma and PTSD really are, what EMDR is, and how a session feels, why it works, the brain's filing system, the 8 phases, step by step, what the evidence actually shows. Most of us can bring an old, difficult memory to mind and feel only a small, manageable twinge. The memory is there, but it stays in the past, where it belongs. After trauma, something very different can happen. A sound, a smell, a tone of voice, or even a quiet moment can throw you straight back into the worst day of your life. Your heart races, your body braces. It can feel as though the event is happening all over again, even years later. If that is your experience, I want you to hear one thing clearly: this is not weakness, and it is not something you should simply get over. It is how the brain can respond when an event overwhelms our usual ability to cope. The memory gets stored in a raw, unfinished form, and it keeps firing as if the danger was still here, and it is treatable. Let me start with what trauma and PTSD actually are. Trauma is the lasting emotional response to a deeply distressing event, such as an accident, an assault, a medical emergency, a natural disaster, or childhood abuse or neglect. Many people who go through a frightening event feel shaken for a while, and then slowly recover. That natural recovery is the most common outcome. For some people, though, the distress does not settle. When symptoms last for more than a month and get in the way of daily life, the result may be post-traumatic stress disorder, or PTSD. It usually shows up in 4 ways: re-experiencing, through intrusive memories, nightmares, or flashbacks; avoidance, staying away from reminders, places, and conversations; negative shifts in thinking and mood, like guilt, shame, numbness, or feeling cut off from the people you love; and heightened arousal, feeling on edge, jumpy, irritable, or unable to sleep. Repeated or prolonged trauma can also lead to what we now call complex PTSD, which adds struggles with emotions, self-worth, and relationships. This is where EMDR therapy can help. EMDR stands for Eye Movement Desensitization and Reprocessing. It was developed by the American psychologist Francine Shapiro, beginning in the late 1980s, and it has grown from a simple technique into a structured, 8-phase psychotherapy. Here is what makes it different. Unlike some talking therapies, EMDR does not ask you to describe the trauma in detail, talk through it again and again, or do homework between sessions. Instead, you briefly bring a distressing memory to mind while I guide you through sets of bilateral stimulation. That usually means gentle side-to-side eye movements, and sometimes soft alternating taps or tones. Over a session, the memory tends to become less vivid, and far less emotionally charged. To understand why that works, it helps to know the idea behind it. Called the Adaptive Information Processing Model, the model proposes that the brain has a natural system for processing experiences. It sorts them, learns from them, and files them away as ordinary memories, often while we sleep. But when an experience is overwhelming, that filing system can jam. The memory gets stuck in an unprocessed state, stored with the original images, body sensations, emotions, and beliefs still attached. That is why a trauma memory can feel so present years later. The goal of EMDR is not to erase the memory. It is to help the brain finish processing it, so it can be stored like any other memory, something that happened in the past, rather than a threat in the present. Now, the 8 phases. And the most important point is that the actual memory work does not begin until we have laid careful groundwork together. First, history taking, where I learn your story and we choose which memories to target. Second, preparation, where I explain how the therapy works and teach you grounding and calming skills you can use anytime. Processing only starts when you feel ready. Third, assessment, where we pick a specific memory, the negative belief attached to it, and the positive belief you would rather hold. Fourth, desensitization, where you briefly hold the memory in mind during the bilateral stimulation, so the distress you carry starts to fall. Fifth, installation, where we strengthen the positive belief until it feels true. Sixth, the body scan, where we settle any tension the memory has left in your body. Seventh, closure, so every session ends with you feeling stable and grounded, whether or not the memory is fully processed. And eighth, re-evaluation, where we check what has changed and decide what to work on next. A question I hear often is whether this is just hypnosis. It is not. During EMDR you stay fully awake, aware, and in control the entire time. It is a structured, evidence-based therapy. In fact, EMDR is recommended for adults with PTSD by the World Health Organization and by Australia's own Phoenix Australia guidelines, supported by many controlled trials. How long it takes really does vary. A single incident trauma may respond in a handful of sessions, while complex or repeated trauma usually needs longer. And we build stabilization skills first. After a careful assessment, we set a realistic, personalized plan together. If trauma memories are still holding on, please know that help exists, and that recovery is genuinely possible. EMDR is one evidence-based path worth exploring at our Bella Vista practice. You can read the full guide, or book an appointment, using the links in the description below. Before you go, here's a quick recap of what we covered. What trauma and PTSD really are, what EMDR is, and how a session feels, why it works, the brain's filing system, the 8 phases, step by step, what the evidence actually shows,